Hello, my name is Martin Anslow. I am a clinical technologist working at the Nuclear Medicine Physics Department at Kent and Canterbury Hospital. I previously worked for some time in radiation physics and I'm now currently in a training year to kind of cross over into nuclear medicine. I studied at the University of Kent at Canterbury, leaving with a BSc in physics, and decided to pursue a career in medical physics as a way of putting my degree to good use, as a way to help people. So a little bit about what we do in nuclear medicine physics. Our duties include but are not limited to providing dosimetry for the clinical team and for ourselves. That essentially means that we will distribute dose meters and then analyse the results to make sure that everyone's radiation doses on a monthly, 2 monthly basis are within both legal limits and reasonable working limits. We also conducts routine quality control on the various pieces of equipment within the department. This includes 2 gamma cameras, multiple radionuclide calibrators, and a gamma counter. I'm personally in quite a interesting position in that I am part of the physics team, but I also have some clinical duties as well, specifically the glomerular filtration rate exam that we provide for patients who are either about to start chemotherapy, are currently on chemotherapy, or potential kidney donors. It's essentially an exam where DCPA is administered. It's a radionuclide that makes its way around the bloodstream, and then we take 3 blood tests, run them through the gamma counter, and we can work out how much of the radionuclide tracer that we've injected the patient with still remains over time, and then we can work out how well the kidneys are washing it out from the patient's system. But I mean, in nuclear medicine, we do many more exams than that. That's just the one I'm most acquainted with. So it kind of gives me that unique way of being both physics and clinical, which personally I love. We also have just started our radioiodine therapy treatment, which I personally haven't started doing, but I will be doing soon. So yeah, in a nutshell, that's a small picture of what we do in the department. So my experience so far has been pretty overwhelmingly positive. I found myself lucky enough to be in a great team, both within physics and the wider clinical team. The variety is great, like I say, being able to sort of get a hand in on the clinical side of it as well as the physics side of it. It's been really good just to sort of expand my knowledge of medical physics in general, having that radiation protection, radiation physics background, to be able to supplement that and then move into nuclear medicine. I really feel like I've kind of lucked out in being able to get that more expanded view of medical physics and therefore a bit more of healthcare science in general. I've been able to develop new techniques in terms of venipuncture and cannulation, and kind of got to grips with all this new equipment, sort of outside of just the gamma counters and gamma cameras. Sort of day to day, I feel like my skill set is massively improving all the time. And one of the best parts is you get that patient contact, which you don't get in all areas of healthcare science. So to be able to have the kind of behind the scenes academic knowledge and experience, as well as kind of seeing the end result of what it is that we do, and getting that patient contact is really rewarding. And yeah, I'm having a great time so far and looking forward to the future. So just to summarise, because I'm aware that I'm very quickly going over my 3-minute time, I've had a great experience so far. It's a really positive working environment. I'm really excited for the future within nuclear medicine. Some big things coming, such as some lutetium exams that are going to be coming our way. And yeah, very happy to be part of the healthcare science network and looking forward to seeing what everyone else has to say. Thank you.